Hi, my name is Dr. Vishakha Sharma, and today I'm going to talk to you about medical science optional syllabus. Okay, so let's decode the medical science optional syllabus. The first thing that you have to understand is that it is not the whole MBBS syllabus. Okay, it does not mean whole 5.5 years of MBBS. It does not mean all 19 subjects. So some subjects are completely missing, like anesthesia is completely written off from the medical science optional syllabus. Okay, if we take the example of medicine, in CNS, there are only two topics like meningitis and encephalitis. So, GBS, ischemic stroke, so many other important big topics are not a part of the syllabus. Okay, let's take the example of general medicine. So, in infectious disorders, there are a few diseases: typhoid, rabies, AIDS, dengue, kala azar, Japanese encephalitis. In CVS, there is only one thing that is going to be asked: is ischemic heart disease. There is no arrhythmias. So arrhythmias, which we really fear, right? And cardiomyopathies and so many other diseases. They are not a part of this syllabus. Okay. Respiratory, there are four things: bronchial asthma, tuberculosis, pleural effusion, and pulmonary embolism. Okay. In GIT, there is malabsorption, acid peptic disease, viral hepatitis, and cirrhosis of the liver. So, if we see in CNS, I already talked about there are only two topics: meningitis and encephalitis. In blood, also, lymphoma is not there, the platelet disorders are not there, anemias, they're not there. Only two topics: coagulation disorders and leukemias. Okay. In endo, also, adrenal gland is not there. Okay. So, only diabetes and hypohypothyroidism. Pituitary gland is also not there. Okay. So let's take the example of another subject like anatomy, upper and lower limbs. We study so much about femoral triangle, cubital fossa, muscles. All of this is not part of the syllabus. Only blood and nerve supply of upper and lower limb, and that too they keep repeating between ulnar nerve, medial nerve, and radial nerve, right? Rarely they've asked about femoral and sciatic nerve, right? But so mostly they're repeating these things. Okay, so it's very narrow with respect to upper and lower limb, right? Microbiology, from whole of the bacteriology, only three bacteria are asked: Shigella, Salmonella, and Neisseria meningitidis. That is it. Okay, so you have to understand that the syllabus is not that wide, but if you compare it with other optional subjects, yes, then I would say that it is wider. But it is also more rewarding. Okay, if you are going to invest your time in this, you will see returns. Your score can go up to as high as 290, and this will give you a clear edge over other people. Okay, so return on investment is high. Lastly, I would say that don't fear the syllabus. You have to trust your foundations. They are familiar concepts, there is predictable pattern, and there are proven results. You have seen that AIR1 last year was medical science optional syllabus. So just don't fear the subject. Go for it. Okay. So that's it from my side. Thank you.